Okay.
Hello, Ava Cecilia. Welcome to Jefferson Hospital. What position would you be applying for today?
I'll be applying for the new ICU nurse position.
All right, I'll ask you a few questions.
Okay.
What motivated you to pursue a position in ICU as a new graduated nurse?
I've always been interested in clinical care because I like understanding why certain things happen in the body. Um, During my clinical rotations, I found myself learning a lot about like complex conditions and how little changes can mean a lot. And I really think the ICU is the perfect place to get more experience in that.
All right. Tell me about a clinical experience where you cared for an unstable or rapidly changing patient. What did you do, and what did you learn?
In one of my med surge rotations during clinicals, I had a patient who had a sudden shortness of breath and was very anxious. As the nurse, I stayed calm and immediately assessed their airway, their breathing, and their vital signs. And I notified my clinical instructor and the other nurses. That experience taught me how to stay composed, how to respond quickly, and communicate clearly with those to make critical decisions.
Okay, good. As a new grad, how do you plan to handle the steep learning curve and the stress of sorry, transzoning into a high accuracy environment like the ICU?
When it comes to the learning curve, I'm very realistic. I know that it's a challenge, but it's a challenge that I'm ready to face. I plan to take advantage of my orientation to ask questions, study protocols, and much more. I'm also very open to any constructive criticism, and I don't hesitate to ask for help when I need it.
All right. Describe how you prioritize care when multiple tasks or patient needs require your attention at the same time.
My approach is to practice based on what is most critical to the patient's survival and stability. I use my ABCs as my guide. For example, airway or breathing issues always come before routine tasks. Once I've addressed the immediate needs, I move on to time sensitive situations like medication, safety concerns, and assessments. I also continuously reassess to make sure that everything is right with the patient and that the patient is not in critical condition no more. And I also make sure to communicate with the team to make sure that everyone knows what's going on.
All right. The ICU requires strong teamwork and communication. Can you share an example of how you collaborated with others during clinical or school projects?
In my clinicals, we often have to work together to care for multiple patients at one time. So I would make sure that I communicated clearly and I delegated tasks that were within our scope of knowledge. I also would check in to make sure that things were okay and that there was nothing that we missed. There was one day when our unit was very busy. It was a lot of critical care patients, but I helped another student with dressing so that they could help me prepare meds. So it was kind of like we both needed each other's help during that time.
Okay. How would you handle a situation where you feel unsure, overwhelmed, or unfamiliar with an intervention while caring for a critical patient?
As a new nurse, there will be moments where I don't know something. So I've always believed that it's okay to ask for help. My priority is to always make sure that the patient is safe despite me not knowing. So I always consult my charge nurse to make sure that everything is okay to proceed with, and that she also makes sure that I'm very comfortable um, with what I have to do. If it's something that I have no experience doing, and I let her know I'm uncomfortable, she lets me know. So with that experience, it just lets me know that it's good to ask for help to do something rather than doing something that is not in my scope of knowledge.
All right, that was good. Thank you.
Thank you.